Okay, and we are recording. Uh, Welcome everybody currently in the call, and those of you who might be watching this after the event occurred. This is the Scholars of Academic Research Psych Talks for Dr. Janice Fung. Give you a little bit of a background for Dr. Fung. Dr. Fung received her master's degree in 2013 in social ecology, I apologize, from the University of California, Irvine, and received her PhD in 2017 in psychology and social behavior, also from the University of California, Irvine. Also, Dr. Fung is being brought in under the DEI grant, which was awarded to local faculty members, Dr. Iturbide and Dr. Villarreal. So that is who is currently funding the Psych Talk event this time. And today, Dr. Fung, just to give you a brief title, will be talking to us about autism spectrum disorder and how it affects adolescents in community contexts. So without further ado, Dr. Fung, take it away.
Thank you so much. Let me just go ahead and try to do a screen share. I think I've lost some of you in this, trying to make this a full screen. Oh gosh, where'd everybody go? There you all are. Okay, let's try this out. All right, so do you all see my PowerPoint? Yes, just a thumbs up, would be great. Okay, great. All right, so thank you so much for that lovely introduction. So I'm gonna kind of go over my program of research today, but I know that a number of people are really interested in the martial arts study that I did, so I'll kind of focus a bit on that. So the title of my talk is It Takes a Village, Children and Adolescents with Autism Spectrum Disorder in Family and Community Context. So you've probably heard of the saying that it takes a village to raise a child. But what exactly does this mean? It means that it's really important to have lots of people interact with children to help them grow and reach their full potential. And this saying is especially important when we're talking about raising a child with autism spectrum disorder, oftentimes because people in the village may not actually know how to raise a child with autism. And so it takes a lot of hard work and commitment to build a village for a child with autism. And so the goal of my program of research is essentially to build a village for children with autism, or in other words, to help increase our understanding of the development of youth with ASD so that we can increase resources for families that are affected by ASD. So for my talk today, I'm going to focus on like a brief overview of my first line of research, which examines challenges in the individual child with ASD and how that might affect the systems in their microsystems, specifically their family and peer systems. Next, I'm going to present background and study results for my second line of research, which focuses on improving those challenges within that individual child with autism through the use of community-based contexts. And then finally, I'm going to close with the significance of this work and present some of my current ongoing projects that I'm pursuing and plan to continue to pursue in the near future. So just to give you a little bit of background information, autism spectrum disorder, or ASD, is a prevalent neurodevelopmental disorder, and it has two diagnostic criteria according to the DSM-5. The first diagnostic criteria is deficits in social communication. So this includes challenges with social emotional interactions. So things like understanding sarcasm, understanding conversational turn-taking, understanding like body language, as well as challenges with both verbal and non-verbal communication, like eye contact with other people. The second diagnostic criteria is the presence of what are called restricted and/or repetitive patterns of behavior. So these include things like restricted interests, like an extreme interest in cars or dinosaurs or subway maps, And it also includes repetitive behaviors. So these are things like spinning the wheels of a car, hand flapping, saying the same thing over and over again. And so we have deficits in a lack of social communication, as well as the presence of these restricted and repetitive behaviors, also known as RRBs. And so these are the core diagnostic criteria for ASD, but many youth with ASD also face challenges that don't fall into these two main diagnostic domains. And these are some of the variables of interest that I explore in my program of research. And so going back to that first inquiry that I wanted to talk about, when individuals with autism experience these different challenges at the individual level, those could spill over to affect the family and peer systems as well. So as an example, some of my earlier work in collaboration with the UC Irvine Center for Autism Research and Translation looked at examining the role of poor sleep quality in adolescents with ASD and how that affected their individual well-being as well as their family well-being outcomes. And in this study, I found that when adolescents with ASD had poor sleep quality, that was associated with them having more problems at the individual level, including more depressive symptoms and more externalizing problems. But these sleep issues also spilled over to predict more conflict at the family level. So these adolescents with poor sleep quality also had more conflicted family relationships between the parent and the child, as well as more conflicted relationships with their siblings. And so some of this past work has shown these challenges that the individual with ASD experiences could negatively affect the other people in their lives. But this relationship is also dynamic and reciprocal. And that means that the inverse relationship is also important for us to consider. And in fact, the role of the family and peer systems could also help support optimal child outcomes in these individuals with ASD. So that actually ties us nicely into my second line of research, which is to examine those autism challenges within community-based context. So in other words, can the world, the community around children with ASD support their development to help improve some of these challenges? And specifically, I explored this question using a community-based martial arts intervention to help improve executive functioning in a sample of children with ASD. So to give you a little bit of background about executive functions, this is a really broad umbrella term, but it refers to a host of interrelated cognitive processes that drive effortful, goal-directed behaviors, usually in novel and non-routine situations. And in a nutshell, executive functions are really complex processes, and they're really important for us to learn. And so for today, I'm going to focus on talking about the 3 core executive functions. There's a lot more than this, but we're just going to focus on these core. One of those is behavioral inhibition. So this is the control and override of your behavioral urges, such as at the end of this month, when you're at Thanksgiving dinner and you have that one relative that's going off on a rant. Your behavioral inhibition skills is going to help you keep your mouth shut so that you can try to be as polite as possible at your Thanksgiving family dinner. Another executive function is working memory. Working memory is when you're holding information in mind while you're also mentally manipulating it. So if I told you to, like, what's 15% of your bill so that you can tip your server, then that, if you're doing it in your head, that would be working memory. And then lastly, cognitive flexibility. That is trying to adjust to whatever change demands, such as when you have a certain belief and then now you're confronted with new information. Can you adapt what you know to accommodate this new information? Can you have that cognitive flexibility? So these are 3 core executive functions. Now, one thing that we need to know is that executive functioning deficits are very, very common among individuals with ASD. These dysfunctions in executive functioning have been linked in part to those RRBs that I mentioned earlier. And again, remember, these RRBs are a part of that diagnostic criteria for ASD. So for example, poor behavior inhibition has been associated with more self-stimulating behaviors in some individuals with ASD. And in addition, there have been numerous studies that have linked these associated deficits in executive functions in other vulnerable populations, namely children who have ADHD, as well as children who are from low socioeconomic backgrounds. But fortunately, executive functions are one of the slowest developing of all of the cognitive processes, and it's actually one of the last of the cognitive abilities to reach full maturity. It continues to develop well into adolescence, through adolescence, and into the early to mid-20s. And also, fortunately, executive functions are malleable with effortful practice. And in fact, there have been a number of interventions that have been implemented with typically developing children that have proven, that have been supportive in improving executive functions. These have included things like computerized training, mindfulness practicing, as well as trying to integrate some of these executive functioning practices into the classroom curriculum. Now, another way that executive functions can be enhanced, and this is a much lesser studied intervention, is through physical exercise. So for example, past research has, with typically developing children, have found support for school-age children who participated in a sustained and frequent exercise program. They did see some improvements in their working memory. Oops. And it's important to note that repetitive exercise, such as running on a treadmill, that alone is not sufficient for long-term gains in executive functioning. Rather, in order for executive functioning to improve with physical exercise, that physical exercise needs to be increasingly complex over time. And it has to be cognitively challenging. So it's not just mindlessly running on a treadmill, but rather engaging in physical activity, physical motions that require you to actively use those executive functions. So in other words, in order for a physical activity to be effective in improving executive functions, it also has to use your executive functions. So we're kind of taking a use it and improve it sort of approach. And so a physical activity that might be particularly effective in improving executive functioning in children and adolescents with ASD is martial arts training. Now, when we usually think about martial arts, one of the first things we think about is discipline. But what exactly does it mean to be disciplined? And in fact, this actually goes along very nicely with our definition of executive functions. Are we able to control our inhibitions? Are we able to regulate our emotions? And these are things, again, that are often compromised in ASD populations. And so martial arts could be helped or could be used to help improve executive functioning in children with ASD. In fact, martial arts has been used in previous interventions with those vulnerable populations, namely children from low SES backgrounds and children with ADHD. So in my study, I used a martial art intervention to help improve executive functioning in children with ASD. I used a mixed martial arts approach, or MMA approach, which includes consolidated elements and techniques from over 20 different martial arts. And I picked this approach for two reasons. The first is that there's a lot of different techniques. And so I was hoping that because children with ASD are widely diverse with different strengths and weaknesses, that an adapted MMA intervention could provide students with a variety of different tools that can help accommodate a diverse range of their abilities. And hopefully that can help them generalize to different contexts. MMA is also considered a low to moderate intensity exercise, which may be beneficial for children with ASD, especially because some children with ASD have low muscle tone. So something that requires very high intensity may be too difficult for them. So my participants were 34 children with a confirmed clinical diagnosis of ASD. Their ages range from 8 to 11 years with a mean age of about 9.3 years. And then the majority of them were boys, which is actually quite consistent with the sex differences that we do see in ASD diagnosis. Boys are more likely, 4 times more likely to have ASD compared to girls. And then as shown here, the race and ethnicity of the children was diverse and representative of the local area. So I will get to kind of what these the different measures were, but children did a pre-test assessment, and then they were randomly assigned to either the MMA group or to a waitlist control group that did not participate in any martial arts between the pre and post tests. And so after random assignment and then after an attrition of 4 kiddos, there ended up being 14 children in the MMA group. All of them were boys. And then 20 children in the waitlist control group, and they were 70% boys. So we did have some girls in that waitlist group. So in terms of the procedure, at both the pre-test and the post-test, parents filled out a questionnaire that reported on their child's executive functioning skills. And then at that time, the child also completed a behavioral measure, which was a computer-based executive functioning assessment at both pre and post-test. So the parent reported executive functioning was done on the questionnaire that is the Behavior Rating Inventory of Executive Functioning, also known as the brief. And some of the sample items included things like, my child does not think before doing, so they are impulsive, or my child thinks too much about the same topic. And then the brief included a global executive functioning composite that had 3 indexes for behavior regulation, emotion regulation, and cognitive regulation. And on this measure, higher scores indicate poor executive functioning. And then as the objective measure of child executive functioning, I used a computer-based test called the Hearts and Flowers task. And in the Hearts and Flowers task, there were 3 blocks. In the first block, this was the congruent block, also known as the hearts block. And here a heart would appear on the screen, and then children just had to press the same side as the heart. And this block measured working memory. And so can you hold the rule in your mind and then respond in accordance to that rule? So again, you would see the heart, and so you would press the button on the same side. So if the heart was on the left side, you would press the left. If the heart was on the right side, you would press the right. Next, in the incongruent block, participants saw a flower, and now they were instructed to change rules. So when they saw a flower, they were instructed to press the other side. Now, this also tested working memory because they had to remember that rule of flowers other side. But it also tested behavior inhibition because they had to also inhibit their response of pressing the same side as with the previous hearts block. So in the incongruent block, when the flower appeared, they had to press the opposite side. So if the flower was on the left side, they would have to press the right side of the screen. And then lastly, there was the mixed block. So the mixed block had both hearts and flowers that appeared in a random order. So now they had to use their working memory to remember the rules of hearts are on the same side, flowers are on the opposite side. They had to also use behavioral inhibition to try to not do or not follow those rules. And then they also had to use their cognitive flexibility because they had to flexibly change those rules as a heart or flower randomly appeared on the screen. And the dependent variables for this measure were accuracy, or the percent correct, and response time in milliseconds, or how long it took them to respond. So as I said, they got the questionnaire and the computer-based test at both pre and post-test. After that post-test, children that were randomly assigned to the MMA group now began an adapted MMA class. And so the dosage that I used for this was based on previous martial art interventions, and it consisted of classes that were about 45 minutes long, took place twice a week for 13 weeks, totaling about 26 sessions. And I did train the head and assistant instructors in how to interact with children with ASD. All of the instructors had plenty of prior experience working with children, but only a few had some experiences working with children with ASD. So this way I kind of was able to get everybody on the same page. And then lastly, an important component of the MMA intervention was that I included peer buddies. So peer buddies were typically developing child volunteers. They were actually students that were in the typically developing martial arts classes at the studio. And they ranged in age from 8 to 13 years old, with a mean age of about 10 years old. A little bit more than half of those volunteers were boys. And so these peers served as the peer mediators to help work with the children with ASD during the MMA intervention. And so in this peer mediation, then the peers, so for example here, the child in the black shirt is the peer buddy and the child in the gray shirt is the participant. And so the role of the peer buddy was to model appropriate behavior as well as to help facilitate the delivery of the intervention. So this is a general overview of the structure of each of the classes. Each class started with bowing in and some moments of meditation and reminders of the daily tasks of the day, just to kind of help focus the children. It then followed a warm-up activity that had some sort of stretching, coordination, and then some sort of light aerobic activity like jogging, working on footwork. And then the most important part of this was this curriculum practice. And so I'll actually talk about that part next. But the curriculum practice was where the peer buddies and the children with ASD essentially worked together to learn the different martial arts strikes, so like the punches, the kicks. This curriculum practice changed over the course of the program, but everything else was consistent with each class. And then lastly, each class does end with a cool down and some sort of social game like tag or dodgeball. So remember I said previously that in order for physical activity to be helpful in improving executive functions, you have to also use executive functions while you are engaging in that physical activity. And so the cognitive complexity here did increase over time. So in this 13-week period, the curriculum was divided into thirds. So in that first third, or weeks number 1 through 4, children learned anywhere between a 1 to 4 step sequence, and then they practiced this with their peer buddies. In the second third of the curriculum, so weeks 5 through 8, they learned some more complex actions, so anywhere between 3 to 9 step sequences, which included things like grappling and working offense and defense. And then in the last third, or weeks 9 through 13, they put all of this together. And so there's a combination of striking and grappling, offense and defense, and the steps of sequences range anywhere from 7 to 13. And so as you can see from the way that the curriculum was designed, that it was meant to get harder and harder over time, so that as children learned basic skills, they were able to move on and apply these skills in more difficult settings. And so remember, there has to be that advancing cognitive complexity, and that is what helps improve executive functioning in the long term. So I used mixed effects regression models to examine the effects of group. So that's the MMA versus the waitlist control group, and time, looking at pre versus post-test. And then to measure effect sizes, Cohen's D-index change scores were calculated, and the magnitude of these effect sizes were computed using Cohen's classic definitions of a small, medium, and large effect size. So for the results, as a reminder, my target variables were the parent-reported executive functioning on the brief, which was that global executive functioning that included scores of behavior, emotion, and cognitive regulation. And then the other variable was the child's objective executive functioning performance on the Heart and Flowers task, specifically accuracy in each of the 3 blocks, and response time in each of the 3 blocks. So let's start off with the results for the parent-reported executive functioning. So for the model testing parent-reported executive functioning, the results did indicate a significant interaction between group and the global executive functioning composite. So as a reminder, for this measure, higher scores indicate worse executive functioning, so you kind of have to flip things around a bit. So this is the model testing the parent-reported global executive functioning. And as we can see here, there was a significant interaction between group, global executive functioning over time, such that the waitlist control group, which is the solid line, had a 4.36 worse global executive functioning at post-test compared to the martial arts group, and comparing for and controlling for pre-test scores. So that MMA group there is the dotted line. And remember, higher scores are worse executive functioning, and so we do want to see that score getting lower over time, which we do see there in that dotted line. And this was a large effect size. You can see here that both groups at pre-test, time 1, started off at around the same level of parent-reported executive functioning, but by time 2, the MMA group did have a lower and therefore better parent-reported global executive functioning score. And then for the models testing child performance on the computer-based Heart and Flowers test, only accuracy but not response time had significant results. And then the significant result in accuracy were found for the congruent block, which was hearts only, as well as in the mixed block, which had both hearts and flowers, but not in the incongruent block, which was flowers only. And so here, this is for the accuracy of the congruent block, which again is hearts only. So here the result indicated a significant interaction between group and predicted accuracy in the congruent block, which again only tested working memory. And here the MMA group had an accuracy score that was 9.77% higher than the waitlist control group at post-test, controlling for those pre-test scores. And as with the other one, this was a large effect size. So as you can see there on the dotted line, which is the MMA group, the MMA group did have a slightly lower accuracy at time 1, but this difference at time 1 was not statistically significant. And then you can see that by time 2, their accuracy did improve, whereas it looks like the control group actually declined in their accuracy for the congruent block at time 2. This shows the results for accuracy in that mixed block, which again, remember, measured all 3 of those: executive functioning, working memory, cognitive flexibility, and behavior inhibition. And so as we can see here on the dotted line, the 2 groups performed about the same at time 1. But by the time that they got to time 2, we can see that the martial arts group improved drastically in their accuracy in the mixed block compared to the waitlist control group, which appeared to stay about the same between pre and post test. And so to summarize these results, for the parent-reported measure of executive functioning, there was a significant effect that was found for the MMA group. And then for child performance on the Hearts and Flowers test, significant results were found for accuracy in the congruent and mixed blocks, but not for the incongruent block, and then not for any of the response times across all 3 blocks. So what can we say about all of this? The study did find improvements in 3 of these core executive functions that we talked about following this implementation of a community-based MMA program for school-age children with ASD. I suggest that the cognitive complexity with that curriculum over time, as well as the physical activity, helped drive these findings. But I also recognize that the intervention itself had a lot of different components. And I think that there were multiple elements that might have helped make this effective. So my steps are to isolate these components, to examine which of these mechanisms really were responsible for the observed improvement, or whether they were an interaction of several of these mechanisms. And furthermore, the executive functioning skills that were gained in the context of this intervention do appear to be generalized to the parent observed context, such as in the home. So in terms of theoretical implications of this work, the study does increase our understanding of how malleable executive functions can be, particularly in children with ASD, and this really has been widely understudied. The study results also Am I still a host? Yes, I am. Perfect.
Yes, the floor is yours.
Thank you. Do you all see my PowerPoint still? Yes, great. Okay. Well, so what was I talking about? I was talking about middle childhood. So middle childhood is this period that we first really start to see these like signs of executive functioning emerging. And so this is really important for us to study because past research has actually found that when 4th and 5th graders were given some sort of executive functioning intervention, they actually improved way more than the 1st graders who were given that same intervention. And so it might suggest that some younger kids are not quite at the point where they can really benefit from executive functioning interventions, whereas these children in middle childhood are more ready to benefit from some of these interventions. And then because the study did use peers to help deliver this intervention, these findings also help us better understand the role of the social and community context to help improve executive functions in children with ASD. Now, in addition to this, we also have some practical significance. And in terms of practical significance, these findings might be extended to other activities too, such as sports teams or yoga. And these activities also have the potential to improve executive functioning if they could be structured so that they could be also cognitively complex, as well as include some sort of component with like mindfulness or meditation. I also think activities like martial art or dance or anything else, they're just great because they give children with ASD a sense of normalcy and fun. And I think that oftentimes the focus with ASD is like intensive therapy and like, let's improve their academics. But we also really neglect the importance of just having pleasurable activities and how pleasurable recreational activities really do help support our development and our well-being. And then in the case of this work, this fun activity also create opportunities to help improve executive functioning, which past research has also linked to academic performance. And in fact, executive functioning has shown to be more important for school readiness than intelligence. And in another study has been found to predict math and reading competence throughout all of the school years. And so we should really think about incorporating these recreational activities that are enjoyable into a child's daily activities. And that will also help facilitate optimal development and learning across different contexts. So I'd like to close with a quick overview of some of my current directions, as well as the third and related line of my program of research that I'm currently pursuing. So far I've talked about my first line of work, which focuses on autism challenges and how it spills over to the family and peer systems. And I'd like to expand the work that I've done so far to look at other domains. So currently, my research assistants are collecting data on a study examining the role of ASD challenges on adult typically developing siblings and how they talk about their brother or sister. And so my RAs are currently conducting semi-structured interviews to help collect this information. The second line is to apply the knowledge that's gained from this first inquiry to help improve those autism challenges within these community-based contexts. So currently, my grad student is in the process of planning a basketball intervention to hopefully support executive functioning in children with ASD. And then finally, my third line of research will connect my autism work with culture and other social categories, which is something that I'm addressing right now in both of my current studies with my students. And so I plan to conduct translational research that explores the intersectionality of developmental disability and other social categories like race, SES, and how all of this connects to the development of children with ASD and their families. As for example, I already said that we know from past work that children from low-income backgrounds do have more executive functioning deficits. And then I just told you about how executive functioning deficits are a challenge in kids with ASD. But what about kids from low-income backgrounds who also have ASD? They kind of have this like double jeopardy, this greater risk as a result. And so I would like to explore this intersection by examining how low-income families can benefit from these community programs. And we really can't ignore that there are these disparities in how low-income families who have a child with autism might not have the access to the same resources as those who are from higher SES families. So by considering how these various forms of social stratification interact to help influence that access to these community-based programs, I hope to use my work to help increase inclusion and access to resources for these special needs families, particularly those from marginalized groups. So in conclusion, I will remind you that it does take a village to raise a child, and especially in the case of children with autism, it takes work that helps build that village. And so that really is the goal of my work, is to build that village for children with ASD and to help increase our understanding, to help support optimal development across a wide range of settings. So with that, I'd like to thank all the families that ever participated in my research studies, as well as all of my funding resources and my past and present research assistants. And then I, of course, would like to thank ODEI and all of you for inviting me here today. And I would be happy to take any questions that you might have. Let me end this. Stop share. Any questions? You can type it in the chat or you can just unmute yourself and ask. I see a hand raised. No? I can't see everybody, so you can just unmute yourself if you have a question.
I have a question for you, Dr. Fung.
Sure.
So I was thinking about kind of the regulating capacity of physical activity for kids, right? And if you had found anything where you compared kind of like that. I know you talked a lot about how there's that need for that advancing cognitive flexibility in the tasks. So if you had any like research that looked at like the difference between if you had two groups with those similar, like a physical activity that didn't have that advancing cognitive
Oh,
flexibility,
that's a good question.
and the martial arts things.
Yeah, that's a great question. So that's actually my next steps. So I think like with this, what I was saying earlier is that like there's a lot of different parts of it, right? Like there's the advancing complexity, there's a physical part, there like the physical challenge, there is that mindfulness component that we kind of would like whenever kids would get really frustrated or really dysregulated, we would bring them back to like breathing stuff that we did at the beginning to help regulate themselves. And so that really is an unanswered question because there were all these different components, but I didn't really have an opportunity to isolate them. At the time, I actually did try to have a comparison group where I had a third group that was doing sports. And so I wanted to see like, was it something about martial arts that's the cognitive complexity part plus the mindfulness plus the physical activity versus something like basketball or soccer where it is physically challenging, but you don't really have the whole like advancing cognitive complexity. And so I did have that, but I only got 3 participants for it. So, and I was a little bit time constrained and just needing to get the project done. But that is my next step. And that is actually something that my grad student is working on next so that we can try to figure out what about this intervention could be replicated in some other activity like basketball or soccer, because I definitely think that that is possible. Something like yoga, right? It's very low intensity, but it has a lot of mindfulness, right? You're like constantly paying attention to your breath. And that is something that you don't really get in soccer, right? And so I think there's a lot of opportunities for that. I was also really interested in dance because I didn't have a lot of I didn't have any girls in my not that I didn't try, but I did have at least 2 or 3 girls drop out of the martial arts intervention. I think when I asked why, they were just like, she just doesn't like it. So I think that it is a little bit of some, gender stereotyping where in the future I would like to try to recruit more girls or try to implement this in an activity that maybe might be more appealing to girls. I think something like dance or cheer has the potential for cognitive complexity and the physical part, but maybe it's just more stereotypically for girls and maybe it'll get more girls interested in it. But I don't really know. Those are the next steps.
Thank you. That's really cool. So.
Ooh, there's a question in the chat. Wouldn't an alternate activity benefit from social interaction? Yes, absolutely. That was actually another variable that I looked at in addition to the executive functioning. And so I did also see an improvement in social skills after the implementation of the martial arts. And I think that it is in part because they did have an increased opportunity to be with other children. But I think that there are some parts of the training that provided social opportunities that you may not normally get, right? Like if you're running on a treadmill next to somebody else, that's not really the same as if like this person is your dance partner and you have to like dance with this person. That's going to require a lot more social awareness. At least with our kiddos, they had to learn that like my right and your right are different when we're facing each other. So recognizing, like trying to take that perspective was really difficult for them at the beginning. So I did look at social interaction as well and working on a paper right now that is publishing those results from it. What other questions do you have?
when you were choosing your sample, did you have certain criteria you looked for? I'm thinking like comorbid conditions, level of diagnosis, and maybe like the amount of like early intervention hours they might have had previously.
That's a great question. This is definitely a challenge that you get when you're doing any sort of ASD research. So if you look at like the autism intervention work, the ones that have like really large sample sizes usually will screen for intellectual functioning, or they'll screen for like verbal ability. And then a lot of the published results are only representative of children that are like on the higher functioning end of the spectrum. In my study, I didn't do that because I didn't want to limit the opportunity for children. I would say that certainly children who have a higher, have more verbal abilities, particularly like children who have better receptive language, can understand more of what you're saying to them, they definitely benefited more than the children who had lower verbal understanding. Same thing for intellectual functioning. They just definitely benefited a lot more from it. But I didn't want to exclude anybody for this, just because, I don't know, that's always kind of been an issue with me with the past research, is that people often screen for them just because some kiddos can't do the tasks that you're asking of them. But I just didn't want to do that for this study. That is kind of the trade-off you have when you want to have good external validity. You do sacrifice that a little bit. I did sacrifice some of that control. And but I'm okay with that, because I just didn't want to, I mean, if my whole point is about inclusivity and I'm excluding kids who don't meet a certain intellectual functioning criteria, that seems a little bit hypocritical in that sense, for the sake of clean research, right? And so the trade-off then is that my research, like, it's a little muddier because there's a lot more variability in it. I think there's a lot more individual differences. I think some kids benefit more than others. But I did collect that information. So I did have information on like how many hours of social skills did they get otherwise. What else? Any medications they were on, any other comorbidities. I did collect that information and I did look at it just to see if there were any confounds. And that's kind of funny that you bring it up, because that's how you know the difference between like developmental psychologists and somebody who like doesn't do that type of work at all. Because somebody had said to me, well, you should have just like told parents to like not put their kids in therapy anymore, so that you get rid of that confounding variable of them having other therapies. I was like, find me a parent who is willing to pull their kid out of therapy just to do your research study, right? Like, that's not going to happen. So it's not realistic. And so it is muddier in that way, but at least it has that external validity. Yeah, that's a good question, Doug. Yvonne had a question in the chat that says, were you worried about southpaws as confounds? So for those who don't know, southpaw is somebody who is left-handed. The majority of the kids didn't come with past martial art experience. I did have a couple of left-handers, but they were perfectly fine because they just started, it was the first time they were learning martial arts. So they just learned it orthodox, like traditional right-handedness. Ooh, a question from Claire in the chat. I wonder what kind of results we would see with the mostly individually performing activities such as gymnastics versus a team-based activity such as soccer. I think that's a really valid question. And I think that was one of the things that I couldn't answer in this study because I was just trying to look at just martial arts, but you're right. There's a lot of different components in it. I think one of the things about like martial arts makes it a little bit unique is that it's kind of individual, right? You're kind of learning things on your own, like you're doing things on your own, but you also need another person to help you learn, especially that perspective taking part, right? And we know that our kiddos have a hard time taking others' perspective. And so like my right and your right, or like what you understand versus what I understand. And then even when they started doing partner work where they would like practice with one another, they like nobody hurt each other, which is actually really nice. But we did really closely monitor and remind them of like, you know, you have to be really gentle when you're working with another person versus if you're like punching the heavy bag, that's very different. And so they did kind of have to have a lot more of that self-monitoring, which is actually one of those higher executive functionings that I didn't talk about today. But I think it's very interesting to think about how this could generalize to other activities. Was there any explanation for the control group's change scores? That's a good question. The control group didn't do any martial arts between pre and post test, but that was really the only thing with the control group. They continued on with like business as usual. So I don't know why the control group scores looked a little bit differently between pre and post test, but I did look at the whether they were significantly different between pre and post test, and I didn't see anything there. And so I don't really know why. It might just be an effect of time. It wasn't that long of a time, only a few months, so we don't expect to see huge changes in terms of maturation. We have to also remember that they were randomly assigned, so that does kind of get rid of any other things. But I don't know. That's a good question. I'm not sure.
Maturation is a spontaneous change that isn't expected, so it could just be something that naturally happens with. And you said they were in therapy anyway?
Some of the kids were, yeah. They just kind of continued on business as usual.
Yeah, so that, I mean, that, and at least in my opinion, from that's a possibility.
Absolutely.
It's just normal stuff that's going to happen.
I think so too. Thank you. What other questions do you all have? We have time for like maybe one more question, right?
I have one, but I've been greedy and I don't want to ask if somebody else has one. So please, if anybody else has one, feel free. Otherwise, I will go ahead. Okay. So I know you're a developmentalist, and I'm curious if you're planning on following those kiddos for a little while.
Oh, that's a good question. Oh, and then there's another question.
Oh, sorry, I ran over somebody. My bad. I just am curious about that because I'm curious what kind of benefits you'll see long term from that sort of.
I would love to be able to do some sort of follow-up. I think that it was just really hard to follow up in general because like the thing is like families are just really, really busy and it made it really hard to like continue on in that manner. My next steps really are because my sample, even though it was ethnically diverse, it was pretty homogenous in terms of family income level. And so I really wanted to replicate this study more with a low-income sample because I think that they're going to differentially benefit from something like this. And then I think that when I do that, I would like to follow them up more long-term in that way. A question in the chat. Did ASD need to be explained to the peer buddies, or would that not have accurately reflected typical interaction with typical peers? We did. So I actually did train the peer buddies ahead of time in like how to respond. Like for example, if you say hello to someone and they're not looking at you, how can you work around that? Or how can you get their attention? So I did train the and did try to explain it to those peer buddies. I will say that I was lucky because those peer buddies are actually really unique children because they were actually recommended by their coaches. And so in their own classes, they've already demonstrated high levels of compassion. They've demonstrated leadership skills in their own classes. And that's why they were referred to us to be peer buddies in the program. And so I will say that like there may not be fully representative of like your average peer, which I think that your average peer without an explanation, without, they may not be as compassionate or kind, especially if you're not supervising them as an adult. So I think our peers were unique, but I would, one thing that I wish that I had done, which I will do in the future, is to try to collect pre and post test attitudes and like ratings of empathy, ratings for like what their views are about ASD. But I did get some really nice anecdotal reports. So that is a nice inspiration for the future. And so I think one of the moms shared with me, like the peer had like a journal, journal or diary that he had to write for a class. I wrote something like, at first I was scared because I thought that people with ASD were really aggressive. And then I learned that they were kids just like me. I was like, oh, that's nice. So it does. And so I wish that I had captured this, but in the moment, that just really wasn't my focus. But definitely moving forward, I'd like to be able to look at those attitudes after having that experience. And well, they can beat up the less understanding peers. You know what, frankly, my hope is that from this experience, you know, when they're at school and if they see or hear one of their peers being rude or making a mean comment, that they're going to be the ones to stand up for this other kid. If even just one kid does that, I think that I'll feel really happy about having the peers involved. And so I think that that's kind of part of inclusion, right? It's getting to know people for people and not just for what their label is. And so I am really glad that they had that experience, and I really hope to be able to expand that in the future. Any other questions? Great questions, by the way. Oh, stop. It's because it's dinner time. He's biting me.
Okay, well, everybody, if there are no more questions in the chat, no more questions vocally, I would like to thank once again Dr. Fung for coming and giving us an amazing presentation on her research and what she does. If you all want to give a little emoji clap or a clap with you know, if you have your camera on, give a little clap for Dr. Fung as well.
Thank you, everyone. Thanks for coming back after getting kicked off of Zoom. Thanks for your patience with my cats rummaging around in the background. And thanks for the great questions. And I was so happy to be here. So thank you so much for having me.
Thank you again, Dr. Fung. And for those of you who are watching at home, thank you for watching, and be on the lookout for additional Psych Talks in the future. And on that note, I'm going to end the recording.
Thank you.